Hi, everyone. So, as you know, my name is Rosie Mensa. I am super excited to be here with you all, really to offer this important conversation on culture, equity, diversity, and race in dietetics. If you haven't already put it in the chat, let me know where you're calling in from, what you do, and what brought you here today. So my goal is really to have an important conversation on the need for us to really talk about health equity and food justice within dietetic practice. And not everyone here today is a dietitian, and that's okay. If you're working in food and health and really working in that intersection, this conversation and this work is extremely important. So I have prepared a couple of slides, but I definitely want you to participate in the chat if something resonates with you, and really to use this as an opportunity to learn. Okay, so as we get started with today's webinar, I want to ask you to grab a pen and paper so that you can take down some notes. I hope you came with an open mind and a willingness to learn. I think that if you signed up for this webinar, you definitely have that. If you have any questions, feel free to put them in the Q&A box, and I will be able to get to them at the end. Participate in the chat if something resonates with you or if you've learned something new. Please have respect for me as a presenter and for this topic. I think, often when we talk about these issues, people might feel uncomfortable, but this is really an opportunity for you to learn. And also stay until the end to find out more about the CDer Course. So a couple of learning objectives for you. By the end of this webinar, you'll be able to develop an understanding of how systemic racism contributes to health inequities. You'll learn why representation in healthcare matters. You'll understand the difference between food insecurity and food justice. And you'll learn how to have conversations about anti-racism and anti-oppression without feeling like you don't know enough. I often see that is a big area for dietitians and nutritionists where they feel like they don't know enough. And a good place to start is just to start somewhere. So even if you don't know enough, you can communicate that. So I'm hoping that by the end of this webinar, you'll have more confidence and more skills to talk about these issues. So a little bit about me. I don't want to speak about myself too much because I figure most of you already know who I am, but I am a registered dietitian in Toronto, Canada. I also have a Master of Public Health. So I've really always been interested in working with people to improve healthcare, improve health access through food, and really on a bigger scale. So that's why I studied public health. I am also a content creator, so I've grown a platform on social media, including Instagram, LinkedIn, of about 15,000 people now, really with a focus on culture, diversity, food justice, and really building healthy relationships with food. I also do a bit of consulting, and at the core of my work is really to advocate for better relationships with food and your body. And a fun fact about me, I love making charcuterie boards. So let's get into this presentation. And I want to pose this question to you. This is not something that you need to necessarily put in the chat, but I invite you to think about it. When was the last time you had to decide between purchasing food or purchasing medication? I really want you to spend a minute thinking about that. Or another question for you to think about is, why is it that Black people in both Canada and the US are more likely to be food insecure than white people? Take a few minutes to think about that. Okay, so as you start to think about this, and we have some comments of people actually living with this right now, this is a real reality for a lot of people who have to make this decision on a regular basis, especially in high-income countries around the world like Canada and the US. And something important to know is that this is compounded by race. So as I mentioned before, why is it that Black and Indigenous people are more likely to be food insecure and have higher rates of food insecurity than white people? So these things are compounded by race, and it's really important as food and nutrition professionals for us to think about these things and to take action with them. I think it really goes beyond just making recommendations for eating on a healthy meal planning on a budget. It goes so much farther than that to really think about systemic issues that contribute to people having to make these choices. So a little bit about me and why I do the work that I do. So as I mentioned, I grew up in an area in Toronto, Ontario, often referred to as you can see in these images, considered to be the neighborhood in Toronto that's least livable, or Canada's darkest neighborhood. Imagine growing up with that stigma and your neighborhood being called that way. You know, it definitely played a role in me learning more about social justice issues and really understanding why my community was often filled with high rates of chronic illness and food insecurity. Growing up, I really didn't feel good about myself because of how my community was represented. And in addition to that, I was one of the 28.4% of Black households that was food insecure. So growing up, I couldn't really understand why we didn't have enough food and why there was often diet-related chronic illnesses. And, initially I thought, is it just because people don't know how to, budget or manage their money? But I quickly learned there are so many systemic factors that contribute to people not having enough food or not having good health. I actually was featured in a Toronto Star article which talked about how good quality of life is just a dream for too many Torontonians, because there are people who continuously have to make those choices between paying for their rent or buying food, whereas in different parts of the city, that's not the case. So this early life experience around learning more about chronic illness and why my community members were experiencing it at disproportionate levels, as well as my lived experience with food insecurity, showed me that there was an opportunity to make change when it came to the intersection of food and health. And that's really what I did and why I wanted to become a dietitian. So now, as a registered dietitian, I use my lived experiences and my expertise to advocate for changes in the food and healthcare system. So this might look like what I'm doing today, hosting this webinar to invite my peers to learn about these important topics and really transform their practice. It looks like speaking to the media about diversity, health, equity, and culture. It looks like co-founding a space for dietitians and students to advance food justice. It also looks like supporting people at the front lines living with food insecurity and disordered eating. And also, I work with different corporations to help teach their teams about health, nutrition, and building better relationships with food. So going back to that first question that I asked initially, when was the last time you had to decide between purchasing food or purchasing medication? How many of you are familiar with something called the social determinants of health? Let me know in the chat. These are non-health related factors that contribute to health. So health is not just based on your health behaviors. I really want to emphasize that. It's not just based on individual health behaviors. And unfortunately, that is often a narrative that we see in healthcare. And that continues to harm people, especially people of color, as we see that they are experiencing poor health and food insecurity at disproportionate rates. So I have here a diagram where you can see some of the social determinants that contribute to health. So there's things like race, and I want to actually talk a bit about that because I was taught to believe that race is actually a contributor to poor health, so based on your race. But when you start to think critically, is it race or is it racism, right? So does being Black inherently make you prone to chronic illnesses? No. There's systemic contributors that disproportionately impact people of color, especially Black and Indigenous folks, when it comes to food access and health. There's things like income, right? So we'll go into this a bit later, but thinking about how a lot of people lost their employment last year at the beginning of the pandemic, and we saw that there were increases to food insecurity in most places. So if you don't have enough income, you're unable to purchase things like food or purchase things like medication or go to your doctor's appointments or things like that. So all of those things contribute to health. So you may have the knowledge on, knowing what foods are nourishing to your body, but if you can't afford them, how far can you really go? So another factor is negative experience within the healthcare system. So there's a lot of stories about people of color just not being treated well within the healthcare system. So whether that is, Black people's pain tolerance not being respected or listened to, or whether it is people believing that individuals have drug or alcohol addictions and not being able to get the support that they need. These are real stories that affect people every single day. And things like food insecurity. But again, food insecurity is an income problem, not a food problem. Any other contributors that you can think of, feel free to let me know in the chat. But really what I'm hoping that you understand is that accessing food and good health is so much more than about your individual knowledge. It goes way beyond that. And it's important for us as health practitioners to not only consider that, but work in a way that is to advance people's ability to live and to have good quality of life. So it's really important for us to think about these factors, but truly practice in a way that considers them. Okay, we have some other comments here. Bias, definitely. Imagine being taught your entire career that race is a social determinant of health, and then you start to believe individuals just solely based on their race, they're at risk for more health conditions, and then you treat them differently. But once you start to think critically and see that it's not someone's inherently their race, it is a system that continues to oppress them. So as we go through this presentation, I want to highlight a couple of terms. You may be familiar with these, especially if you are someone who studied public health. I do see a few people. So health inequity, it refers to differences in health due to a lack of fairness and justice. And I really want to emphasize this because it's important to separate the term health disparity versus health inequity. So a health disparity is a difference in health. It's just a health difference. So for example, older adults are more likely to have chronic illness than younger adults. That's a disparity. But the fact that Black and Indigenous people are 3 to 5 times more likely to be hospitalized due to COVID-19, that is an inequity due to a lack of fairness and justice. Often, when it comes to health inequities, these differences in health are avoidable and occur due to an unfair system that perpetuates injustice. So does everyone understand the difference between the disparity and inequity, and why it's important to see these not just as differences, but differences that are due to a lack of fairness and justice? So when you start using those terms, that I hope that you can really think critically about what they mean and why this exists. So let me know in the chat. Okay, so it's resonating with you. That's great. And the next term I want you to think about is food justice. This is really important, especially I think now. I don't know about you, but we've been seeing a lot of campaigns around, especially during the holidays, for emergency food. Donate to your food bank or do this food drive. Do you ever stop to think about how people are surviving through the rest of the year? Think about it. Food justice really goes beyond food insecurity to look at the systems of oppression within the food system and the food movement. So it goes beyond providing emergency food, but it explores why people don't have food to begin with, or why there is inequities in food access. Food justice acknowledges that food is a human right and that everyone should be able to realize their right to healthy food. Okay, so I want to do a brief case study to help really drive home the points that I'm trying to make in this webinar. So, COVID-19, this is a pandemic. So we are all going through this, and yet it looks very different to different groups of people. Okay, so I pulled this chart from the CDC. So this is American data. I do have another chart for Canadian data as well. But this basically looks at risk for COVID-19 infection, hospitalization, and death by race and ethnicity. And I don't know if you can see it clearly, but if we're looking at different groups of people, so we have here not white non-Hispanic persons, American Indian or Alaska Native non-Hispanic persons, all Asian non-Hispanic persons, Black or African American non-Hispanic persons, and Hispanic or Latino persons. So we have different groups of people, and in the US, they do collect race-based data. So it is an opportunity for us to explore things by race and look at those intersections. But as we can see here, the reference group is white non-Hispanic persons. As you can see here, if we're looking at Black or African American non-Hispanic persons, they are 2.6 times more likely to be hospitalized for COVID-19 and 1.9 times, so almost 2 times more likely to die from COVID-19 compared to white non-Hispanic persons. So remember, we are all going through this pandemic, and yet there are such differences, so those inequities between different groups of people. So I want you to start to think about why this happens. And in that little paragraph under the chart, it says race and ethnicity are risk markers for other underlying conditions. And I want you to stop and think about that. Is it race or is it racism? Right? Because why is it that, being Black, just by being Black, you're 2 times more likely to die from COVID-19? It's not just because you're Black. It's because there's a system that exists that continues to oppress you and to impact your health. So this is a summary table from confirmed cases of COVID in Ontario. So that is a province in Canada. And we can see similar trends here where people of color are more likely to get COVID-19 than white people, right? Even though they make up less of the population. So I really want you to think about why this happens. And I invite you to really be critical. It's not just because people don't know how to social distance or don't know how to wash their hands. It goes so much deeper than that. And unfortunately, we often tend to blame people for their health outcomes instead of holding systems accountable. Okay, so based on the information that you've seen, what are some of the factors that have contributed to these inequities? And if your first thought was that, wow, these people might not be following the protocols, I invite you to really take a deep dive and to think critically and to think about why you might have that thought, which is a bias towards these groups of people. So as we look at the case study for COVID-19, some of the factors that have contributed to these inequities may include the fact that people of color are often service workers and essential frontline workers. Unfortunately, they were not given the same sort of respect and support as people like, doctors and other healthcare professionals, which, definitely played such a huge role in managing this pandemic, but also look at essential frontline workers like people who are cleaning or working in grocery stores, people that don't have the ability to work from home. Those are also essential workers that are often people of color. People of color tend to live in neighborhoods with crowded transportation or might be living in multi-generational homes where the risk of spreading COVID is higher. They, like we mentioned earlier, poor experiences within the healthcare system and with healthcare providers, or living in a neighborhood with poor access to nutritious and culturally appropriate foods, and racial discrimination and violence that people of color experience every single day. So it really goes beyond individual behaviors, and that's really what I want to emphasize here today. I know that in my education and training, this social determinants maybe was one class. I'm not even sure if I even had a class on it, and I studied public health. So I want to invite you to really think critically and not just solely look at individual behaviors, but look at the systems in which individuals live and work. So since we're all going through this pandemic, really use it as an opportunity to explore the inequities that occur in both the healthcare system and the food system. Because this is a pandemic that we're all going through, and yet why does it look so different based on your race? And this is also something compounded by your different layers of identity, so something called intersectionality. So it's important to use that lens as well. So now many of you are, food and health professionals. So how does our industry perpetuate racism and oppression? Any thoughts? Let me know in the chat. Here are a couple of different papers and articles where, this is being called out, right? So there was an article last year in the New York Times on, is American dietetics a white bread world? These dietitians think so, right? So, people are starting to have these important conversations, and we need to continuously do this in order for change to happen. So one thing that I think is very important is the fact that we don't do enough to address the history. So if we're unwilling to talk about what has happened in the past, how do we expect things to be different? I often see that, things are done in a performative way as well, or we're continuing to teach or to practice in a way that we know doesn't help people. So we have a couple of comments in the chat. So using BMI for all groups. Yep. We know that doesn't work, and yet we still continue to do it. Weight bias and stigma, definitely. Or the fact that I believe the statistic is that about only 3% of dietitians in the US are Black. And we don't have that information in Canada, but it's probably similar to that. So the fact that the population in the US is Black, the Black population in the US is about 14%, and only 3% of dietitians are Black. We really need providers to reflect the communities that they're serving. So these are just a few articles and a few things to keep in mind when we're looking at our specific industry, that really we need to start having these important conversations and acknowledging what has been done in the past. So a couple of other great points. Yeah, using a Eurocentric lens, as an approach to even providing nutrition recommendations, a one-size-fits-all approach. Yep. So think about it. And honestly, I've been educated in the same way you have. So it's going to take work for us to really unlearn and relearn, but we need to be doing that work if we really want to transform lives and transform our practice. Okay, so the bottom line is that Black Lives Matter or 215 children are not trends on social media. And what I mean by this is that it looks nice to put up a black box or to say that you're an ally or to, hop on these campaigns for a day. But what happens after that? These are Black and Indigenous lives. They're just not a trend for you to use a hashtag or for you to make yourself feel better. It's important that you make choices every single day. That's really how we are going to achieve change. And that's how, you really act and advance anti-racism. So I don't know if you remember last June where social media, and particularly Instagram, was flooded with a whole bunch of Black squares for, Blackout Tuesday. But I really invite folks to think about, what have you done since? It's important to remember that just because it's a trend for you, it's someone's real life, their everyday experiences, and something that they have to live through even after a trend moves on to the next thing. So change requires you to get uncomfortable and to leverage the power and privilege you have. I have power and privilege in my position, and so do you. And we all need to remember that we have more power than we think, and even the small daily choices that we make can lead to meaningful change. And you have to be honest with yourself and address your bias. Things are not necessarily going to change in a day or a week, but you have to continuously want to make change and continuously take actions. And that might mean putting yourself out there and perhaps being told that this isn't maybe the best way to do things or the most meaningful way. but you can't be worried about doing things perfectly, because that leads to inaction. But with all that being said, I do want to emphasize that change is possible, and we are starting to see changes. So even having conversations like this, seeing more research articles come out, more programs being developed, there is opportunity, definitely. And it starts with one conversation and with one action. So here we are coming today as professionals who focus on food and health, but we really need to think about this. To achieve good health for all, we must address and dismantle the systems of oppression that prevent Black and Indigenous people and other people of color from accessing food and good health. This requires us to challenge white supremacy, racism, poverty, and other forms of oppression that oppress diverse groups of people. So this takes work. And that's what I really want to emphasize here, that this takes work and continued daily action. So, I gave you this whole lecture style on, what is happening, but you're probably wondering, what can you do? And really, it starts with small actions. So you might want to write this down, some ideas for you to really think about, what can I do? Because like I said, you have more power than you think, and you have an opportunity to leverage your privilege. So you might want to take some notes here, but simply continuing to educate yourself. Education really goes a long way, and there are so many free and paid resources for you to learn. So it's not an excuse anymore to say that you didn't know or you don't know enough, because there are so many ways to learn. It's important to pay people of color. So stop asking for free labor from people of color to teach you about their lives or to use their lives as your entertainment. Unfortunately, this happens a lot. And, we cannot do this. If we're really trying to get equity and anti-oppression, we have to pay people for what they know and for their time. Become aware of racial inequities. So not just health inequities, but also think about inequities when it comes to the criminal justice system, or, housing inequity or employment inequities. It's important to look at things from a holistic lens. And as we talked about in the slide around social determinants of health, so many factors that are not related to health impact health. So become familiar with the other racial inequities that exist. So use your vote and your money to advance justice. So put people in positions of power who are advancing anti-racism and anti-oppression. We need people who have power to change policies in those positions. And also use your money. So think about, where are you purchasing things from? Who are you giving your money to? Who are you supporting? And it's important to do this in a way that is meaningful, not in a way that is tokenistic. Another example is last June, we saw that there was an increase of people supporting Black businesses, but that has tapered off significantly since. And that's what you call performative, where, you do something just for show, but it's not meaningful change that you plan to maintain over time. So it's really important for you to do things in a way that is meaningful. So there's a whole bunch of different suggestions here and things that you can do. And a lot of these don't cost you anything. So it's really just about taking that step and stop trying to be perfect, or, saying that you don't know enough. You can start somewhere. That's really what's important. There's a great comment here that says the pay element is so important, especially in dietetics, where RDs and students of color are asked to put in so much emotional labor and constantly volunteer. Yes, Allison, definitely. And this is a huge problem in our industry that we really need to change. So I want to share what has helped me to really apply an anti-racist and anti-oppressive lens to my work. And I call it the Cedar Framework. So culture, equity, diversity, and race. So how did it get me to where I am now? So when you look at culture, really practicing cultural humility and inviting people to embrace their cultural food. When we look at the E in equity, increasing my knowledge of systemic racism in the healthcare system and advancing food justice. Diversity for me looks like avoiding tokenistic representations of diversity and making space for everyone to be in the room in a meaningful way. And race or anti-racism, making the daily choice to live and practice in a way that is anti-racist. So we live in a racist world. So this is something that takes time. Not every one of you, this is going to take you to critically think and be reflective. There's no perfection here. It's just action. So applying the Cedar Framework has given me the confidence to do many things. So whether that's writing a deputation to help support a program for Black food sovereignty in Toronto, whether it's, like I mentioned earlier, co-founding a group, Dietitians for Food Justice, to help dietitians, dietetic interns, and students advance food justice, whether it's speaking in publications about the different issues that exist in healthcare. So here I talked about how you can be knowledgeable about a group and yet still hold so many biases toward them. So it's given me the confidence to lead programs and really tailoring resources to make it appropriate for different cultural groups. And this is just the beginning, right? So I'm not saying that you need to do what I'm doing, but you need to do something, right? So how can this framework help you? Well, it can give you more knowledge on topics of equity, culture, equity, diversity, and race in dietetics. It can give you more confidence in engaging and leading conversations about these issues. It can also give you a platform to discuss why we need to address food injustices and why it's important. It can also give you the self-awareness. I think that's one of the biggest things, is to really have self-awareness, to know what you don't know, what your biases are, and what you can do about it. It's okay not to know everything. And I, just like you, I'm also, been educated in this field where there is a lot of perfectionism, and there's often a sense that, you don't know enough, but how are you going to learn if you don't start somewhere? So using this framework has really given me more confidence and self-awareness that I need to do that introspective work. So it's also giving me the ability to think critically, take action, and learn from my mistakes. I know that I've spoken to a lot of people and they're afraid to do something wrong. Well, I'm here to tell you that you'll probably do something wrong. And that's okay, because you'll learn and you'll get better and you'll know how to support someone else in the future. But the inaction is what causes harm. And it's given me the ability to identify opportunities to advocate for change, as well as develop resources and supports that advance anti-oppression and anti-racism. So just like this webinar that I'm having today. So as we wrap up this webinar, I wanted to give you 3 key takeaways: that change is possible. Okay, if you leave with that, I will be happy to know change is possible, but we have to take action, okay? Anti-racism and anti-oppression are daily choices. And as food and nutrition professionals, we play an essential role in advancing both the healthcare system and the food system towards justice. So I have this image of a tree where it's like, you need a strong foundation, you need to plant healthy seeds, and this will allow you to grow a strong tree with beautiful fruit. So it's really a question of what kind of fruit do you want to grow? So what seeds do you want to plant, and what do you want to cultivate and harvest? And I'm inviting you to do that when it comes to advancing anti-oppression, anti-racism, and food justice. So now what will you do? Okay, so we're here today to learn, but to also take action. I want you to take 2 minutes to write down 1 to 2 things that you can start doing right now. Feel free to share them in the chat if you're comfortable, but you don't have to. But I'm going to give you a minute to really think critically and think about what can you do right now. Okay, so I hope you've had some time to think about that. And really, I invite you to do a deep critical thinking at some point and think about what you can do now. And it doesn't have to be something big, but it has to be something. So thank you for sharing some things in the chat there. But I also want to share an exciting opportunity if you're someone who needs more support and who wants more guidance and more information in a curated way. So I created a course called Culture, Equity, Diversity, and Race in Dietetics, and it was created specifically for food and nutritional professionals to advance food justice, health equity, and anti-oppression. So we have some comments here in the chat. Continuing to educate my clients on issues we discussed. Take steps to get involved and support and materials at my new residence. Yes, there's a lot of great things that you can do. Thank you for sharing. So I created the CDer course, and I'm so excited to say that we've had dozens of students take it and really share how much they've learned from it. It was really an opportunity for me to package the information around culture, equity, diversity, and race in dietetics for food and nutrition professionals. So this is the first of its kind, and really I created this course out of frustration in some ways. Last year, I was really hoping that the food and nutrition dietetic organizations were going to provide something for us. But I continued to wait and didn't see anything. So I thought, I have this experience and I can support my peers. And really, that's what led to me developing this course. The fact that my peers wanted this material and the fact that we need this, and really to support our clients, we need to be practicing from this lens. So this course that I've created includes 6 modules. It includes homework, quizzes, and resources to support your learning. So we think about it. We've gone through our whole entire education. Some of you are still in school where, we talk about, things relevant to nutrition, but often we don't talk about or learn about how to work with real people with different experiences. And I truly believe anti-racism and anti-oppression should be the foundation of our work and not just a nice add-on to our work. So I created this self-study course that you can complete at your own pace, and that gives you a good foundation to learn about anti-racism and anti-oppression in dietetics. So here's an overview of the course. It's broken up into 6 modules. So it goes through the foundation, which talks about terminology and language. And that's really key to understanding this work. So initially during this webinar, I told you about 2 important terms, health equity and food justice. But we go through a whole bunch of terms and I provide you with examples so that you can really learn about this material. Module 2 looks at self-awareness and positionality, and it helps you to identify your personal social location and what privileges and power you hold. Module 3 is all about cultural competency and diversity and why cultural competency is important, but it's not everything. So it teaches you how to better honor different cultures, but it also invites you to do a lot of critical self-reflection. Module 4 goes into health inequities, and looks at ways for you to, transform the way you work. Module 5 is all about food justice. So that if that is new to you, this module is all about food justice and why we need to continue to advance food justice in our work. And lastly, module 6 is all about moving towards equitable and inclusive practice. So I invite you to create an action plan and offer additional areas of support. So that's an overview of the course there. So this course is for you if you are ready to take daily action to advance anti-racism and anti-oppression. If you want to learn and you want to have the confidence to talk about racism, health equity, culture, and food justice and dietetics, and maybe even support your peers. And if you're looking for strategies on how to support and provide culturally safe nutrition care, and if you want to know how to show up better as a dietitian, nutrition professional, health coach, student, and as a human being overall. So this course is not for you if you're not ready to check your privilege and get uncomfortable. If you do not see the value in your lived experiences of your peers, patients, or clients, If you're unwilling to decenter yourself or your experiences in conversations about race and oppression, or if you're comfortable with the status quo, and if you're looking to be convinced that a problem exists. So I wanted to share a couple of testimonials from students that have taken the course. So Sarah G is a primary care dietitian. And she had to say in summary, Rosie created an excellent course to challenge people to reflect on their current position and privileges. This course helps to frame where privilege lies and how it can impact people and their health, and how our current systems that we uphold erode an effort to support a person in their health. I'm hopeful more dietitians will engage in this work to actually make a difference. And thank you, Rosie, for creating this opportunity for our colleagues. So that's one testimonial there that I wanted to share. And we've had a wide variety of people take the course. So we've had health coaches, food policy researchers, dietitians, nutritionists, students, interns as well. Here's another testimonial from Nicole, who's a public health RD. So Nicole was actually one of the founding CDer students where I taught the course live. And Nicole said that I had the privilege of taking the first CDer course with Rosie, and I cannot say enough about how great it was. She created such an inclusive and supportive learning environment, and for this critically important topic that is relevant in all practice areas. And lastly, I wanted to share another testimonial from Julie Miller. Julie had to say that my practice has changed dramatically as a result of this course. I feel better equipped to start conversations, offer resources, and invite curiosity. My language is more specific and accurate. My interactions are more reflective, and my circles are wider. Equally, if not more important, I've obtained a heightened awareness of my own implicit bias and the roles I have and continue to have played in perpetuating the status quo within the profession. So those are just a couple of things students had to say about the course. So what you're going to get from this course is the actual course. You're going to also get a cultural competency workbook, an exclusive Facebook community, monthly calls with me. So I do help you go through the course, an introduction to a food justice module, and really tools and resources to make meaningful changes in your life and the lives of the people that you work with, which is priceless. So you're getting a total value of over $3,000. So I ask you the question, and thank you for being with me here for the last hour. How much do you value your growth? Are you ready to get uncomfortable? Are you ready to deepen your understanding of your role and responsibility in advancing health equity, culture, and food justice? Are you ready to take specific actions to be anti-racist and anti-oppressive? And are you ready to show up and do the work? These are all things for you to think about. And I invite you to continuously take those daily actions. Thank you so much for listening and for joining me today. This was really great, and I'm happy to take some questions. So definitely take advantage of that offer for the course, and I hope to see you in the course.